Hi, Dr. Marcia Sirota here, and today I want to talk about the wounded healer. And by that I mean people who go into the helping professions because of their emotional wounds from the past. Now, of course, this is not something that we do consciously. We're not aware that we're choosing to be in a helping profession because of our emotional wounds, but our emotional wounds drive us to go into these professions. And there's a few reasons for this. One of the reasons is that when we've been hurt as children, we have a real empathy that develops for other people who are hurt, and we identify with other people who've been hurt. So we are driven to go into the helping professions because it's almost a way of vicariously healing our own inner child if we heal these other people who have been victimized or who are being hurt. And that also includes animals. Any type of helping profession often comes because we have this over empathy for those who are being in pain, who are in suffering because of our own personal experiences. Again, this is not something we're doing consciously. It is driven by an unconscious empathetic response and an unconscious desire to give some help and some support to those who really need it, especially because perhaps we never got it when we were little. Another reason why we go into the helping professions if we have emotional wounds from the past is because we are driven to the familiar. So we put ourselves in similar kinds of situations in order to try to unconsciously, of course, resolve our childhood issues. So if we've been abused or neglected or exploited, we are attracted to situations in which people are being abused or neglected or exploited because there's a part of us that wants to work out our own trauma, and again, vicariously somehow feeling that if we do it with them, we're going to figure it out for ourselves. Now, of course, it doesn't work this way. We cannot heal our inner trauma through external behaviors. But unfortunately, the unconscious doesn't realize that. So we have to override our unconscious and recognize that being driven to get into these familiar situations is not necessarily what is best for us. And the reason that a lot of these wounded healers get into trouble is because all the wounds that they are experiencing very often will re-traumatize them. So let's say a person has a history of childhood sexual abuse and they go into the Children's Aid Society and they're working there and they're experiencing all these cases of young people with sexual abuse. This is going to re-traumatize them around their own trauma, because what happens is when we have trauma, we can get triggered by similar types of experiences that we witnessed, and that can make us more wounded and create more suffering. And that's very often why people who are in the helping professions become burnt out, become anxious or depressed, and have to take time off work or quit work altogether because they've been re-traumatized by getting into the kind of profession that is constantly re-triggering their trauma. So wounded healers are very often, in every single profession. They are doctors, they are nurses, they are veterinarians, they are people who work in animal shelters, they are people who work in group homes for adults or children, they work for the Children's Aid Society, they're social workers, they're nurses, they're all different type of helping people, and the one thing they have in common is their wound. Now, that's not to say that every single person in a helping profession has childhood wounds that they're unconsciously trying to work through or resolve. However, if you are in the helping profession, it really would be helpful for you to take a minute and tune in to your own childhood experiences and look at whether you might have had some kind of experiences of hurt, abuse, neglect, exploitation, mistreatment, abandonment, anything that might have triggered you to be more empathetic toward people who are suffering today, or to want to be in situations in which bad things are happening as an unconscious drive to somehow resolve your own issues. Because that will prevent you from becoming burnt out, more anxious, more depressed, or having any other difficulties. The other problem with people who are wounded healers is that sometimes it's so painful to face certain types of issues that they just shut down. So for example, I've spoken to other therapists who cannot deal with patients or clients who become angry because they had an angry parent and it was too overwhelming to them to face their client's anger. Or they can't deal with people who have sexual problems because they had sexual abuse in their childhood, and so they aren't able to be helpful in this area. So people who come with their own wounds and haven't dealt with their wounds sometimes cannot be helpful to their clientele because they shut down and they can't give anything because it's too frightening, too threatening for them to go into that very dreaded territory that is triggering so much their own past hurts and losses. So it really benefits every person in the healing profession to look deep within, explore and examine whether or not they have any previous trauma so that they can work with it, heal it, resolve it, and that way they can make a good decision. Do I want to continue in the helping professions? Is this really the right job for me? Or perhaps I've gone into it for not quite the right reasons and maybe it's time for a change in career. Or if I am in the right career and I'm happy doing this, how can I do the very best job while taking the best care of myself and also being able to be available for my clientele without any blocks or areas where I cannot go because of my own wounds. This is Marcia Sirota talking to you about the wounded healer today. Please stay safe, take care of yourself, and I'll speak to you very soon.